Can you believe that you're 36 weeks pregnant, mama? Comment below how you're feeling this week and some new things that have popped up this week in your pregnancy. I'm sure we'll be talking about some of those things in this week's update. Before we do, if we haven't met yet, I'm Bridget, your internet childbirth educator, birth doula, and mama friend. This channel is all about empowering parents through education, and I know that's speaking your language. So subscribe right now if you haven't and hit the bell. All right, so what's happening with baby this week? Your little one is about the size of a mini watermelon and is still putting on weight. Their bones are hardening, so make sure you are eating those calcium-rich foods like organic dairy, collard greens, nuts, and sardines. Baby is shedding their lanugo and producing more and more of that vernix coating on their skin, and with that, baby is also ingesting more of those things as they swallow and digest the amniotic fluid that they're in. This is contributing to the production of meconium in their bowels. Meconium is baby's first poop, but like I mentioned several updates ago, this meconium is sterile, so there's really nothing to be grossed out about it. However, it's super sticky, so after birth, I recommend having coconut oil on hand to put on their bottom and genital area so that when they pass that meconium in their first few bowel movements, it's a lot easier to wipe them off. If you like this tip and you want more tips for that newborn season, make sure you check out the baby care course, which is linked down below. Between now and 38 weeks, you'll be given the option for GBS screening. We talked about GBS back in week 33, so if you missed it, go back to that week and learn more about it. GBS is commonly diagnosed in pregnancy, and if you want to learn more about it, check out the resources that I have linked in the description below as well. Now, baby will be here before you know it, and you're probably making sure that everything's in place, that their laundry is done, and that you have all the essentials for when they arrive. It's important to ensure that the essentials that baby is using and is exposed to a lot of are as natural and safe as possible. A popular laundry detergent, Dreft, which is actually endorsed by many pediatricians, is highly toxic and given an F rating by the Environmental Working Group for Safety and Purity. Instead, I recommend using Drops or Attitude Unscented, which are brands that are safe for the whole family, including baby. And for other essentials like lotion or soap, I personally use beef tallow or coconut oil for baby's moisturizer and don't use soap on them at all while they're babies only drinking milk. Once they are eating solids and their poops change, I do use a gentle soap that's linked down below. And if you're interested in learning more about toxic baby products, I do have a more in-depth video that is linked in the corner of this video. Now, just a heads up, it can feel really overwhelming at first if you're learning about this for the very first time right now. But I encourage you to just do the best that you can, shop secondhand, and buy products that are good for the whole family and don't have to be just used for baby specifically to help save on money. Now, one way that you can start preparing your body for birth this week, mama, is by eating dates. Studies have shown that 4 to 6 dates per day starting at 36 weeks helps makes the cervix softer and more favorable for labor around 40 weeks. They do not induce labor and they will not ensure that you go into labor at 40 weeks or any of that, but they are a natural preparatory tool. If you have gestational diabetes, you will likely not be able to consume all 4 to 6 dates per day, but you might be able to do 1 or 2. You can incorporate them into smoothies, eat them with peanut butter or just straight up grass-fed butter, which I actually love, or make them into protein bars. RX and Scout Organic bars are made with dates already, so those are good options too, and I have them linked down below. Mama, that wraps up this week's video. Thanks for spending this time with me, and I'll see you in week 37.